Won't be long before the Big Bunny visits some of us, hopping into your house with one of these. But who says the Easter Bunny has to deliver a big basket full of sugary tooth-busting treats? We've got maybe some better ideas for you when it comes to your kids' teeth. Dr. Scott Tyler is a local orthodontist who says you better be careful. Do you see, what do you see this time of year? Are the braces, are they broken after Easter?
Yeah, I mean, we see a lot of breakage at Easter. We see a lot of breakage at Halloween, of course.
Yeah.
And really, you know, the main thing now, I think, to drive home is, unlike in the past when you were wearing your braces for 3 years or 4 years.
I remember.
We were talking about, you know, a major sacrifice.
Yeah.
We're going to miss out on 3, 4, 6 holidays. With the technology that we're using now in the office, with robotics and computers and things, we've got the treatment time down to about 9 to 12 months.
Really?
So we're talking about maybe sacrificing for one of these key holidays. And it's not so much a sacrifice as it is really just pay attention to what you're doing. That's the message we're trying to drive home. Take care of these. After you eat these sugary treats, keep them clean. And you'll be fine.
Let's talk about the bad when it comes to Easter candy, because there are, believe it or not, you know, there are some good choices and some bad choices. So bad is one of the Easter staples, jelly beans.
Definitely.
Really?
Definitely.
A little jelly bean.
Little jelly bean, like a little grenade going in there.
Really?
Jolly
Why?
Rancher, Milk Dud, anything that gets onto the bracket, grabs a hold of it, can distort the wire, pull the wire out of the tube. All of a sudden now you've got an emergency visit, the wire's poking you, or worse, the bracket has come off the tooth. And that's not just an inconvenience for the parent and the patient to have to come back to the office. It's really one of those things that slows treatment down. We've got to have you back in, put the bracket on, most likely in a different spot than it was before, and we're kind of backtracking.
Listen, those Jolly Ranchers, they are bad for anybody at any age.
No question.
I like them. But that is the stickiest. I mean, it sticks to your filling, everything. Okay, let's talk about the good, because there are some good choices. We are shocked, Dr. Tyler, that you say Peeps are a good choice.
Well, everyone knows that Peeps are high in nutrition. All these huge nutritional value.
And especially the green ones.
Yeah, the green ones are.
That's like a food group.
Off the chart. So, no, it's not so much that they're good, it's just that they're good in the sense that they're probably not going to rip the braces off your teeth. And that's really what we're about.
Okay.
If you can kind of guide your kids to these ice cream, CDs, nail polish, other things during their orthodontic experience. But again, keeping them clean is the key. After you eat the chocolate, after you eat this candy, you've got to get it off your teeth. And
what are you talking? Like, if it sits on, what if you brush your teeth 12 hours later that night? That's not soon enough?
No, it really should be removed, you know, shortly after. Even if you're at school and you can do nothing else but really swish, rinse with water, and kind of clean the debris off the teeth. Braces are obstacles, and they're allowing these things to sit against the enamel on the tooth, and that's the real issue. You've got to, you know, if it wasn't for the braces, they would just kind of slide. This stuff would slide off your teeth. Braces allow it to sit in one place, and that's when, with a bad diet, pop, juice, Gatorade.
That soda just eats away, right?
Anything that lowers the pH in your mouth, that makes it acidic, will turn that plaque into like battery acid. It'll just eat into the enamel.
All right, what age should kids be going to? My youngest, who's in braces right now, I know we got to go, but she's 7. So what age should kids be at the orthodontist?
Perfect. For the screening exam, age 7 to 8 is what we recommend. We can head off a lot of problems if we see them early.
All right, good advice. Thanks for coming in.
My pleasure.
Are you leaving the treats?
Those are for you.
All right, good.